Hi, you guys. Welcome back for our daily practice questions. It is day 165 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success in their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. But any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. All other resources can be found at my website that is also linked in the description and the bio as well. All right, question number one. A 66-year-old patient presents with multiple waxy, stuck on brown lesions on their back. The lesions are asymptomatic and were noted incidentally. What is the most appropriate management? Is it A, refer to dermatology for biopsy? Is it B, prescribe a topical antifungal cream? Is it C, reassure the patient and no treatment is needed? Or is it D, treat with oral antibiotics? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate management? So this is still just a different form of treatment, right? So I always say you got to run it back and to see if they have provided you with a diagnosis. And if they have not, you got to run it back a step further so that you can determine the diagnosis, right? So here, key identifiers is big right here, especially with derm. But I always tell y'all to know the key identifiers. Here it says multiple waxy, stuck on brown lesions on their back. That stuck on appearance is classic with seborrheic keratosis, right? And also the location. Y'all know I always say with derm, location, location, location. Because on these questions, they have to be descriptive. So they're going to try to describe where it's commonly located. So pay attention to that as well. So, with seborrheic keratosis, the best answer is C. Reassure the patient and then let them know that no treatment is needed. Now, sometimes people have them removed for cosmetic purposes, but there's nothing that is required because these are benign. Question number two. A 42-year-old patient presents with well demarcated silvery scaled plaques on the elbows and knees. There is no joint pain, and less than 10% of the body surface area is involved. What is the most appropriate first line outpatient treatment? Is it A, oral prednisone? Is it B, topical corticosteroids? Is it C, topical antibiotics? Or is it D, methotrexate? Take a moment and tell me what you got in the comments, y'all. All right, and stem of the question here states, what is the most appropriate first line outpatient treatment? So again, treatment, we want to run it back and see if we have a diagnosis. And since we do not, you got to run it back a step further and look at the assessment findings. So again, key identifiers, well demarcated silvery scaled plaques, classic for psoriasis, right? So the best answer here for first line therapy is B, topical corticosteroids. Remember, anything that's around like a mild stage of psoriasis, we treat with topical corticosteroids. When it is more of a moderate to severe stage, we treat with our systemic treatments like methotrexate then. But always start with that topical corticosteroid. All right, and lastly, question number three. A 5-year-old boy presents with honey-colored crusted lesions around the nose and mouth. He is otherwise well appearing with no systemic symptoms. What is the best initial treatment? Is it A, topical mupirocin ointment? Is it B, oral clindamycin? Is it C, oral amoxicillin? Or is it D, topical hydrocortisone? Take a moment and tell me what you got. All right, so stem of the question here states what is the best initial treatment? So again, first line therapy, we want to look and see if there is a diagnosis. And since there is not, you're going to run it back and look at your assessment finding. So we have a 5-year-old boy with honey colored crusted lesions around the nose and mouth. honey-colored crusted lesion is classic and a key identifier for impetigo, right? So with this, because it is a mild case, we would treat with topical mupirocin ointment. So A is your best answer. When we start to go with like oral antibiotics, like your Keflex, this is more so for those wounds that are open or more severe cases. Okay. All right, you guys, we are continuing with our derm treatment with our farm series. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And my website is also located in the description. This provides you with access of all the tools and resources, but it's also broken down for first-time test takers and for those who may be retesting for the exam so that you can look to see which resources may best suit your needs. And it gives you a breakdown of each. All right, you guys, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.